Dr. Mitchell is ready to join us. There we go. Right. Make sure you're right. So thank you to Dr. Mitchell for joining us as well this morning. Minister Steele, of course, the topic on the front burner, for the past few months actually, has been COVID-19. But before we get into that, I wanted to ask you about something that started circulating on social media yesterday as it relates to dialysis treatment at one of our centers. And it basically said government has not been paying its share of the cost for treatment for some of the patients. Can you shed some light on the present situation with that?
Yeah, it's a very unfortunate circulation that's going on there from the service provider. I can confirm that government has been making its payments, which are checks that are made to the Kidney Foundation, and that these payments were made for March and April. And they were collected late. I spoke to the Kidney Foundation, and their explanation simply was because we were on 3-day lockdowns or 2-day lockdowns, that they had some delays, that they also communicated with the service provider to say that they may be late in payments, but rest assured they would be making payments to the service provider. Because their thrift shop as well, which is a main source of income for them, has been closed. We have been in touch with the service provider consistently. In fact, in March, 25th of March, I personally assisted in getting materials for Island Health Services to come up from Trinidad using regional security aircraft, because he did not have his normal methods of bringing supplies up, and also facilitated the clearing of supplies with Amerijet the following week, where places were closed, and to allow Amerijet to deliver the supplies to him. So we've been in constant contact. I would have thought that if he hadn't received payments, based on the fact that his lives at stake, that he would have communicated to the Ministry of Health to find out or to confirm, or to the Kidney Foundation. As far as I'm aware, none of that was done, and just a simple communication to the patients, threatening them basically that if they don't pay, they won't receive service. So I think that is truly unacceptable. As I said, I can confirm that government has been making its payments, that quite likely under the circumstances, like everything else, there are delays in getting those payments to the service provider, which is reasonable under these circumstances. And I think any reasonable individual, especially providing that type of service, would have gone the extra distance as well to simply communicate, to make a phone call to the Kidney Foundation or to the ministry or to the PS, which he does have those numbers. I ensure of that he has the ability to communicate directly with the ministry all the way to the permanent secretary, the chief medical officer, and myself, and has been able to do that in the past. And we have facilitated wherever possible, as we did in March when there was a need to get supplies here. So I'm very disappointed with what I saw yesterday as well.
Has there ever been a situation like this where there has been a delay in payment that probably prepared him possibly for making that move? Or I should say the center.
Not that I'm aware of, because government has never paid the service provider directly. We pay the Kidney Foundation, and they give the support to their members for dialysis. So that payment has been made consistently. In fact, as of December, we increased that payment, which is public knowledge, from 1,000 to 3,000. So in fact, government has been taking a totally different direction of increasing the support being given to dialysis. We did announce that we were setting up a dialysis wing. Under the circumstances, one can expect that there were delays with that because construction had ceased, and we were focusing all our efforts on COVID-19 and getting COVID-19 isolation wards up and running. That now is most evident from yesterday's communication. I have had to make sure that all our energies now, as best as possible, are diverted once more to the dialysis wing at the General Hospital, because we cannot allow this situation to continue. And we have to have responsible service for our dialysis patients. And as such, government has to make sure that we have that service available under the control of government.
Besides IHS, is there any other dialysis center that government contributes to? Is there one in existence in Grenada? Okay. And
No, there isn't.
And what's left to be done for government's dialysis center when construction does resume?
The equipment to be shipped and minor finalization on the site.
Okay. And just remind me where that site is?
The site is at the General Hospital Phase 2 building.
Okay, all right.
The new Phase 2 building.
Okay, all right. So now let's get into COVID-19. What's the latest as it relates to government's fight and battle against coronavirus? Last update, we had 21 confirmed cases with 7 still active. Any changes to those figures? Any pending test results that we are waiting? What's the latest?
No changes to those figures. There were some negative results that were received late yesterday for individuals, frontline or other individuals, either through the hospital or health centers that we felt necessary to test. But all of those results came back negative, hence no release or so, but just simply an update on the figures on our website with respect to number of tests done and but no positives, no change in status to the patients. Dr. Mitchell, George Mitchell, as you have joined, I don't know if you want to add anything to that.
Yes. Good morning, Blossom, and good morning to your listeners wherever they are.
Morning, Doctor.
How are you?
Not too bad.
Okay. I spoke to our medical practitioners just before I came on. Just to reiterate where we were in terms of our patients and our testing, the numbers are the same as per Minister's pronouncement a few seconds ago. And our testing, PCR testing, keep going up, which is a good indication. And none of them came back positive yesterday. Additionally, all the patients are doing well, including the only patient that is currently at the hospital. We did his PCR recently as well, and he was still shedding some viruses, so we decided to, of course, keep him at the hospital. But clinically, meaning his general state of health is very good at the moment, but we're just waiting and making sure that he's not shedding any virus. So as to put anyone out there in danger's way, so to speak.
In relation to the tests, I remember, if not last week before, we were speaking about the aim of testing 1% of the population. And with almost 310 or over 300 PCR tests conducted, I'm sure we have surpassed that number. Am I correct?
Well, not in terms of PCR. Remember, we have a population of about 105,000 thereabouts.
Right.
And
so that includes the rapid tests as well?
Oh, absolutely. If my math, serves me right, if we combine the PCR tests, yes, we have surpassed our 1% by a whole lot. I think we're now going closer to 2.5%, based on the amount of PCR and rapid testing that we have done. So we're doing well. I am not sure where we are on the world scale, but we must be very close to being quite at the top, just like we did when we won gold at the Olympics with Karani James a few years ago. We were number 1. I'm sure that we're aiming to be very, very close to there right now.
Just to give you those figures, Blossom, we've done, as of yesterday, we've done 1,472 rapid tests and 309 PCR, and the count keeps growing day by day.
There continues to be some kind of concern from members of the public as it relates to the legitimacy of the rapid tests. What assurances can you give that these results are accurate and reliable?
You go first, George.
Yes, let me speak to that. Blossom, I am not sure that there are continuous concerns. At the beginning, yes, there were a lot of concerns, but I think time and time again, we have been here and reiterated the fact that in our settings and our experience, the tests are proven to be 100% or almost 100% correct. meaning that we have used a particular and a scientific methodology. What we have done was to take our positive PCR patients and use the rapid test on them. These rapid tests came back positive as well. We also took patients who were negative on PCR and we tested them with a rapid test and they came back negative. So there isn't a more foolproof method of validation or verification of a test by doing or using such a methodology. And that's what we did before we actually started to do mass testing or using the kit as a sampling method, so to speak. So we feel very confident. And just let me add that I was on WhatsApp with the CMO of St. Vincent about 15, 20 minutes ago, asking the same question about the validation of the test. And she said to me that they are using the same test, they use the same methodology, and I joke with her and say, good scientific minds think alike, and they too experience 100% or almost 100% validation of the test kit. So I am not sure about where the other similar test kits came from and their validity, but in Grenada, and I now could speak for St. Vincent, those tests have worked excellent.
Let me add to that, Blossom, from a policy standpoint. The rapid tests, you heard me and Dr. Mitchell refer to them as a form of screening. In the absence of the rapid test, the forms of screening are actual visual observation of a patient or temperature test of a patient. So we've added that rapid test as an additional form of screening. But the definitive test to know whether somebody does or does not have COVID-19 is the PCR test, and that is what we still continue to rely on. We do not declare somebody to have COVID-19 or to be COVID-19 free unless we have done a PCR test on them. The rapid test just helps us screen.
One of the hot topics, I would call it, in recent days continues to be patient 15 and the confirmation of the other patients since then, especially as it relates to not being able to pinpoint the place of contact, the first place of contact for his case. Are we any closer to coming up with an answer to that question as it relates to where and when he got tested, or the other patients so far? Or have we decided or concluded
where
that
you mean where he got infected?
Spread? Infected, yes.
Okay.
Or have we concluded George, that it's community spread?
I will go first here again. It's an interesting case at that particular company. When all our investigation was done, we found that patient 15 was not the first patient in that company that had symptoms. We found that there were other persons, one or two, that had symptoms before him. He was the first one that actually got very sick. So that changed the dynamics in terms of the thinking process. And it would mean or may mean or is highly suggestive that the infection at Caribbean Agro did not emanate, or he was not the first point of contact. It may or may not be the case. And as such, we started to look deeper and deeper and deeper. And as I said on the program recently, our theories abound in this regard. And the strongest of them seem to be directing to some form of contamination from person or persons coming outside of Caribbean Agro to purchase feed. You would recall that we did, in consideration of the plight of the farmers and their chicken, their pigs, etc., we did give consideration to allowing for some form of activity at that company. And so the theory, the strongest that we have, is that someone may have come in there and contaminated one or two persons, or one person that eventually contaminated another person. So that's basically our strongest theory. that we have patient 15 just happened to be the first one exhibiting that kind of symptomology in that particular company. And so when we zeroed in on him, we thought at first that he was the first patient, but in hindsight, that may not have been the case. So we just want to clarify that out there. And I know for sure that at a recent program, Minister also spoke to the fact or to the question of whether or not that infection came from the wheat boat that was anchored and which the same gentleman had some sort of connection with. And we can say proudly so that every single member of that particular boat was tested. We were fortunate in the sense that that boat was still anchored in the harbor. We made sure that they did not leave, of course, and we had all of them tested and they all came back negative. So we excluded that source of infection and concentrated more on what I just described a while ago.
And what's the status with contact tracing and testing the other employees of Caribbean Agro to, maybe close off that part of our fight?
Well, in recent times, this has been our biggest effort, so to speak. A lot of our staff, our nurses at the community level, our epidemiologists have been paying real emphasis on ensuring that particular outbreak is kept in check. And so we have put systems in place to try and ensure that everyone, they are contacted on a daily basis to ensure that they are observing the quarantine measures. We have folks calling them on every day. I'm hoping that by now they are not tired, but I know they would be appreciative that is being done. I know the nation would be appreciative of, as well that is being done. So we are trying to ensure that these people maintain the quarantine and that they're not circulating, even though we have tested them and they're negative. That much care we are actually taking. And come Friday morning, we have also arranged to retest all of them. That organizational effort is already in train. We've been in contact with the management of Caribbean Agro. They will all come there for ease of doing business, so to speak, maintaining first and foremost the social distancing and wearing of their masks. And we will have all of them tested on Friday morning before we can contemplate in any way giving the green light to open that institution. So we're on top of that. We're doing all that we can to ensure that that particular chapter of COVID-19 in Grenada is well managed and managed to the best of our abilities.
Before I ask about workplace protocol, you mentioned ensuring that the patients are maintaining the quarantine, and that reminded me of something I heard recently. Can you shed light on if there was an instance where somebody who has been quarantined was not maintaining that self-quarantine at home and had to be arrested? That's what I heard. Could you let me know if that's true or not?
There are individuals that have been relocated to a different quarantine site where they're under guard and 24-hour observation, where, as I said previously, where we deem the risk to be high of the individual not following quarantine, we have a different facility, and yes, we do have individuals at that facility at present.
Okay, I like how you put it. In terms, going back to the situation at Caribbean Agro, how has that changed or maybe adjusted the ministry's approach to ensuring health and safety at workplaces, now that we have a number of businesses operating on business days? How has that changed the protocols, not just for them, but other business places, different sectors, as we continue to open businesses on business days?
Well, it has changed our outlook on it. It means that we cannot take anything for granted. We cannot take for granted that telling management or owners of an establishment what must be followed, that it will be followed. That we have to put additional mechanisms in place, and we have to ensure that the workers have a mechanism either through their union or through the Ministry of Health also to receive that additional information, education on the various safeguards to be taken. And that in every work site it is, or workplace, it's a unique environment and sometimes involves an inspection depending on how many employees would be there to determine that there aren't areas that may have had a certain amount of blind spots, so to speak, that we didn't cover for or cater for, common areas or so. So yes, it has changed, and it has forced us to ensure that we spend a lot more time on our workplace manuals and safety measures to be employed, and to ensure that the basic rule of 6-foot radius is maintained and enforced wherever possible.
Okay, let's take a quick break. Yes, sure.
I just wanted to add, yes, in keeping with the same question that you asked, we had a very, very informative meeting yesterday with folks involved in the construction industry. And I was actually very surprised that they too, the management of those companies are extremely aware. They themselves are taking in front to ensure that their protocols are up to mark, up to standard. I don't think that they want an outbreak on their property. Everybody is being careful, and that surprised me as well. And prior to that meeting, I had a call from a small contractor, and he said to me, Doc, I'm ready to go. I would not allow anybody on my work site without a mask, without keeping the social distancing, without actually doing their sanitization. So persons are actually taking on for themselves the protection, and that is what we want. We want householders as well, because if we are to open up, say, for example, small construction, we know people have renovations at their homes. That would be difficult to monitor. We are establishing monitoring frameworks, but it is going to be difficult for our inspectors, so to speak, to find every single little house in Grenada where some repair project is going on. So we are actually calling on the population, calling on such persons who have persons on their property to ensure that these persons follow the rules, follow the guidelines. In other words, if you're not going to wear your mask, if you're not going to see you not exhibiting or demonstrating the fact that you are maintaining your social distance, no, you can't do my work. You'll have to go away. You'll have to come back. I'll have to get someone new. So that kind of pressure we're calling on the population to observe as we contemplate the issue of opening up, because we really, really have to look out for one another.
Well said, Doc. Well, let's take a break and come back inside. We are speaking with Minister of Health, Hon.Nickolas Steele, and Grenada's COVID-19 Response Coordinator, Dr. George Mitchell. We are talking COVID-19. We're going to take a break and come back inside. Stay with us.
Long ago, the strength of Grenadians was in their arms as they worked the lands to get food for the table. Nowadays, most Grenadians' plate is packed with lots of starch and meat, little or no vegetables, plenty fried foods, and they wash that down with something sweet while sitting in front of screen. Hard work and exercise seem to be out of style, and lifestyle diseases are becoming the fashion of the day and claiming many lives. Let's make a change to live longer. Let us grow and enjoy a variety of natural and safe, fresh vegetables and fruits every day. Use our local fresh seasoning and spices to make our traditional dishes healthier and avoid highly processed foods, snacks, and drinks. Drink more water every day to help your body function better. Get moving every day. and trade some screen time to share and enjoy healthy family meals. Choose healthy foods and healthy lifestyle. Follow the healthy choices for healthy living guidelines for Grenadians.
We believe this new virus spreads mostly from person to person through respiratory droplets produced when someone who is sick coughs or sneezes. This is similar to how flu and other respiratory illnesses spread. These droplets can land in the mouth or nose of people nearby, or possibly be inhaled into the lungs. Most person-to-person spread happens when people are in close contact. It's also possible that this virus can spread when someone touches a contaminated surface and then touches the mouth, nose, or eyes.
Welcome back to The Point. We are speaking with Minister of Health, Hon.Nickolas Steele, and Grenada's COVID-19 Response Coordinator, Dr. George Mitchell. It's time to open the phone lines for your questions, queries, comments, concerns. 435-2041 is the landline number. You can also pose your questions on the WhatsApp. It's also 435-2041, but please only written messages on the WhatsApp. You can pose your questions on the GBN Television Facebook page and the Grenada Broadcasting Network's YouTube channel as well. If we can please keep our phone calls to 1 minute or less, that would be greatly appreciated. Let's take our first phone call. Good morning.
Hi, good morning. It's just a concern I had from a while now. My concern is the nurses, doctors, and the police officers or the frontline workers. I know that they said that they're going to be testing the frontline workers, but have you considered testing the family of the frontline workers?
Thank you, caller.
Nurses and doctors have been tested and continue to be tested. Basically, those that are on frontline actually working with the COVID positive patients have not been going back to their homes on a daily basis to their families. They have been kept at a different facility when they are off duty for a full period of 14 days, actually. And then they are tested before they are allowed to return home. So that I hope puts your concern at rest, but also should let the nation know the level of sacrifice that the individuals are making in serving the COVID patients.
Let's take another caller. Good morning.
Good morning.
Morning, go ahead, please.
Good morning. We are told about wearing the mask, which is the correct thing to do. But nobody tells us how to handle that mask when we get home, how to dispose of the disposable masks, and how to handle the reusable masks, which should be put separate from the things you come home with. If not, you can be spreading the germs if you put it down any and everywhere. And this will be defeating the purpose. Thank you.
Thank you, caller.
George, you go ahead. I think the caller has raised a very good point that we can spend some time on. Yes.
Caller, very, 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 very good point. I have not heard that one raised explicitly before in that particular manner. But yes, your concern is well said. Our PR team may want to jump on that and put out more information there. But really, we in the broad sense of the word, in terms of handling clothing or any other apparel, any other item that you may deem contaminated, you want to ensure that those are washed separately, those are dealt with separately if you consider that they may be contaminated. So the same thing would actually go to a mask. If you think that for one reason or the other, your mask might be contaminated, and it may be a good idea, or it's a good idea to treat with it separately from the rest of your clothing. That's basically the general idea, but as I said, I will ask our PR team to jump on that and disseminate that quality of information that you're speaking about. Very, very good point.
Yeah, I think we're going to get some public service announcements out on that, hopefully before end of today, just to reinforce that concern that you have.
A WhatsApp question: why are locals barred from conducting construction? However, there are Chinese doing construction work.
Two areas there. The Chinese construction work, they are living on site, have been isolated from the rest of our community, and are operating the same way for whatever someone does in their own home. If they're confined to their own home, they can do maintenance work, etc. And so the Chinese construction workers have been isolated to there. They have not been in general circulation. Whereas for any other construction site, it involves workers coming from their own homes to that site, are transported there and then transported back. When they come to the site, they will be interacting with other workers coming from other households and then going back to their own homes. So it does pose a different level of risk, and that is why you will see a difference between how the Chinese on the housing project are treated as opposed to how other construction sites have been treated to date.
Another WhatsApp question. Minister Steele, you spoke of the patients who have been... Hold on, let me decipher. You have spoken about patients who have been taken to government's quarantine sites and did not say if anybody was arrested. However, can you say if anybody was charged for violating a quarantine order?
To date, we don't have anyone charged for violating quarantine order. We have individuals who've been charged for violating curfew order. With quarantine order, no. Individuals have been removed and placed in mandatory quarantine site under observation there. But no one has been charged to date for violating quarantine. We wouldn't hesitate if the need does arise, though.
Back to the phone lines. Good morning.
Yeah, hello, good morning. Hello?
Morning, go ahead, please.
Yeah, I'm talking about the no offense against the police officers, eh? Yeah, hello, good morning.
Yes, go ahead. Turn down the volume on the television or the radio. Go ahead.
I move away.
Yeah, go ahead.
In keeping with the 6 feet rules, I noticed the police officers and them on patrol. It's about they have the Toyota pickup, and sometimes it's about 4 of them in it on patrol. I wonder that it's a small van, how 4 of them could be patrolling that small van, and when you have to keep 6 feet apart. Could you give me some light on that? Because when I see 4 of them, 3 of them in that small vehicle patrolling, could you give me some light on that? Maybe someone should look at it.
Thank you, caller.
Yeah, to address that, you will see it sometimes even our frontline health workers are closer together than the 6 feet in terms of dealing with a patient, and the police with respect to transport. And as you have seen on social media, when a police officer unfortunately has to arrest or place somebody in custody, yes, there will be breaches. That's why we consistently acknowledge the risk that some of our frontline workers take in carrying out the duties of maintaining law and order and carrying out the duties of providing health care. So it is not a case of being able to say that they have to maintain that 6 foot rule as well. But in the carrying out of their duties, it may be necessary based on logistics or transportation or enforcement or care that they will get closer. But that is not, we use that as an exception as opposed to the rule, and ask the general public, myself included, and Dr. Mitchell included, unless we are police officers carrying out that specific task where it's necessary to breach that, or healthcare workers actually dealing with a patient. But in all of those cases, you will see that the individuals would be wearing masks and would be taking the additional precautions as best as possible. That is why we plead to the population to help us by following the rules, so that the incidence of frontline workers having to breach or put themselves at further risk are reduced. The less people we have in hospital being treated for COVID, the less risk we place our frontline healthcare workers in. The less people we have breaking curfew or not maintaining the law and order or the regulations as per the limited state of emergency, the less chances we have of our frontline law enforcement officers having to be going out there and reacting to or responding to incidences that to maintain law and order.
Minister, may I also add that most of these frontline officers have been subject to rapid testing as well. And so there's the additional comfort among the comrades, among themselves, that they are negative. So that kind of internal security sort of applies to them.
Let me go to the phones. Good morning.
Good morning to my minister, and good morning to me.
Morning, Miss Jacob. Hello. Okay, Miss Jacob, I ain't hearing you. Something wrong with your phone some days now. There is a question on the WhatsApp that asks, are there plans to sanitize and disinfect the Caribbean Agro before it is reopened?
Almost definitely. And as Dr. Mitchell had said, and I said on another program as well, the employees, all employees will be tested again, PCR test again, before that facility is allowed to be open.
Recently, France indicated that in retrospect, they may have had the virus since in December. Would Grenada be willing to investigate and test people who may have had similar symptoms before the first case was announced for the antibodies?
We would, George, that we would be using IgM testing for that and not PCR. Dr. Mitchell can explain the science there. But I also addressed that concern previously, in that if we had COVID, knowing the monster or what we know of the monster called COVID-19, if we had that in Grenada in December, we would be seeing a lot more cases. And like those countries, we would be seeing a lot more individuals in hospital and would have a much higher mortality rate. So that is the one level of comfort. But with respect to the science of being able to test to see, Dr. Mitchell, you can discuss that further. Yes,
the thought blossom has been given. I have had conversations with the folks at SGU in particular, who are maybe best placed to conduct such studies to see what was happening in our population prior to the onset of COVID in January, February, March. And I think that would be a welcome study. They are doing the necessary preparation, so to speak, the paperwork, so that can happen. And it's worthwhile. You can't go wrong, so to speak, if you would do any backward or retrospective study as to what was happening in your country. Nothing's wrong with that, and I think it's a worthwhile venture going forward. But let's concentrate now on ensuring that we do all that we can, and we're calling on Grenadians to join the team in ensuring that COVID-19 is stopped, that we don't have an issue with it, that we forever remain vigilant, because COVID-19, even though we control this now as seemingly we are doing, we don't want to have our guards go down. We don't want to, and I want to reiterate that. Yes, we seemingly are in a better position right now, but I cannot but reiterate that it is absolutely important that we don't let our guards down. And even though we are going to or thinking about opening up gradually, this has to happen alongside us understanding that we cannot keep our guards down, that we do all that is necessary to ensure that if, for example, that we have an outbreak in one area, or we find someone, that we can do the necessary training, tracing, that we can be assured that persons did take their precautions, so that the possibilities of that person having spread the virus is negligible, is almost nil. And that is what we want to preach right now, that if we do that going forward, then we are going to be in a very, very, very good position to contain, limit the spread, if by chance we have any symptomatic person out there at this moment. And that is the message we want to give, that if you do the right things, if you maintain your social distancing, if you wear your mask, just in case there is someone out there that may be symptomatic and has the virus, that they don't transmit it to you. And that has to be understood. And everything that we do from here onwards is going to be directly related to that, or directly with that in mind, so that we don't have a situation where we have to regress and start over again. So that is the message going forward.
Let's go back to the phone line. Good morning.
Good morning. Yeah, 2 points. The people who were having a party on the beach and they broke the curfew and they were arrested. I want to know if they were tested. This is very critical. I want to know if they were tested. That's the first point. Secondly, the question of the uses of the mask. TV stations around the world are showing you how to dispose the mask, how to get rid of it safely. You're getting that information around the world on different stations. Thank you very much.
Thank you, caller.
Well, I think we addressed the issue of the mask earlier from a previous caller. And as to whether individuals were tested because they were arrested for breach of the quarantine, I don't think so, unless any of them at that point were exhibiting symptoms or seen to be high risk or so. They would have been charged and arrested. But no, in most cases, individuals who have been arrested are not going to be tested just like that, simply because of that.
Somebody's asking, can you tell me what are the chances of someone with sickle cells surviving COVID-19? Type SS, sickle cell.
Well, may I address that one? Type SS means that you have full-blown sickle cell disease. It means that you're, in a way, compromised, that your body's ability to carry oxygen is compromised, is limited, is not that of the normal person who doesn't have sickle cell. So yes, that person would be at risk. That would be someone who is at high risk. So in terms of their survivability, that depends on the person's state of health at the time. If they don't have a respiratory problem at the time, depends on our ability to treat them at the time, etc. So it's a very broad question, but yes, they can survive COVID-19, the virus. And I must say that the question is really relevant, because one of our patients, so to speak, did have sickle cell, and as you know, that person has totally recovered and is at their home at the moment.
A lot of our decisions here in Grenada are based on the science. Looking at the science, or based on the science and the modeling, what's Grenada's next step going forward in dealing with COVID-19? The plans are in place, and what are some of the things the population needs to focus on for the next few, what appears to be months of dealing with coronavirus?
Well, there are two parts to it with respect to the science. First part would be the control of any possible spread of COVID-19 and the markers that are used to determine that, which is the continued testing and screening of the population. And if we were to be finding new cases or an increase in the amount of new cases. So depending on size of population, you use new cases or an increase in the number of new cases. For us, because of the size of our population, we can rely on new cases. But also measures have to be taken on the assumption that COVID-19 will be around us and among us for months, if not years to come. And therefore appropriate adjustments have to be made with the way we interact on a regular day or so, the wearing of masks, the maintenance of social distancing, the observance of the various other protocols, cough and sneeze protocols, certain activities being still ruled out in terms of mass gatherings, etc. And also from a ministry standpoint, public health standpoint, we now have to consider the regular inspection of facilities, where before we would inspect facilities from a phytosanitary standpoint. We now have to have an extra level of inspection and also must maintain a rapid response team that allows us, should we find a case or the suspicion of a case, that we can respond to it in a very timely manner, isolate, contact trace, and therefore control any risk to the population. Apart from that, there will be the regular additional rapid tests as new, more types and more accepted levels of rapid tests become available. We will be doing that, as well as the hope at some point downstream that there would be a vaccine that would be given. But in general, we have to make some significant lifestyle adjustments as best as possible so that we can get back to some form of normality as quickly as possible once we are able to rule out community spread.
There's someone asking if products that have been made by Caribbean Agro, if they are safe for consumption.
George?
Unless determined that they are unsafe by our environmental health officers, I would say yes, they are safe. The science, seriously, coming back to the science, there has been, as far as we know, no proof that the virus is transmitted in food. We know that it's transmitted via feces, but not food just yet. We know that yes, based on latest information, the virus has receptors, including receptors in the gut. So investigators are looking at that. But thus far, and based on latest reading up to yesterday, 48 hours ago, or yesterday, the day before, 48 hours ago, there has been no scientific proof that has been spread through food or products from Caribbean Agro. So Caribbean Agro, as far as we know, up until this time, should be safe for consumption.
Yeah, and Blossom, to add, the one thing we do know is that time and heat kills the virus. Certain amount of time if products are just left, and also the products in question are used for baking and cooking. So heat in general also will kill the virus.
Any final words? Go ahead, Doc.
Yes, I just wanted to add in terms of what Minister outlined so comprehensively a while ago in terms of Grenada's position going forward. We are forever fine-tuning our capacity to ensure that we have this virus under control. And I think a couple of days ago I mentioned that we were fine-tuning our contact tracing teams, and that we will continue to do. We want to be in a position as we open up that we are able to respond in a swift manner. We have actually put timelines to being able to do contact tracing for every case within a particular amount of hours, that once we find a case, that we are able to mount an appropriate response within a particular time frame of every single person who has been in contact with that person. So detailed, we are mounting, or we are planning, or we are strategizing to go forward. So that as we speak, we are trying to fine tune. We are also going to ensure that our opening is gradual enough that allows us to ensure that the workplace protocols and the monitoring and evaluation, I say monitoring, not so much evaluation, monitoring can be done as we enter into this new phase. So we're not taking it lightly. We are actually doing this in a scientific and controlled manner that would, in the most airtight way, try as much as possible to ensure that we don't have spread, and that if we find a case, we can safely mount the appropriate response to control it. So we're calling on every Grenadian to be in this with us. We are all in this together. Yes, we are leading it from the COVID committee. Yes, we are leading it from the Ministry of Health, from the hospital teams, and everybody who's been part and parcel of this response. But we must say at this point that it is important that the entire country comes behind this, because we don't want an outbreak. We don't want a COVID-19 in Grenada. So I'm making this passionate appeal there.
Thank you so much. Any closing words, Minister Steele?
No, just to say, as always, to thank those on the front lines, and to thank the population in general for their understanding and cooperation thus far. I know many of us remain compliant and are following the instructions and awaiting the opportunity to get back to some form of normalcy. And we also understand that the new norm is going to be different to the pre-COVID normal way of life. It really is a disappointment, I know, for most of us out there, that Carnival has been announced that the Carnival as we know it is not going to occur this year, but I'm sure everyone understands why that would not be possible. So we take it in stride. We're disappointed and we blame COVID, but we do understand, and that we look forward to being able to slowly ease these constraints, as Dr. Mitchell has said, cautiously do so with the science, and get back to the new norm, and start those of us who have not been able to have income, to create opportunities for them to have a certain level of income, and go, get this economy back up and running while we maintain a safe environment. And to do that, we all have to maintain the discipline. It only takes one person to set us back. But in order for us to move forward, we have to do that all together. But only one can set us back. So I think we need to make sure of that. And what I've noticed with the public is that we are becoming our own neighbors' keepers, and looking out for our own interests and our neighbors, and reporting incidences. And we appreciate that. Royal Grenada Police Force appreciates that. Ministry of Health. It is helping us keep the population at large as safe as possible. Thank you.
Thank you very much, gentlemen, for shedding some light and some information with us this morning on the program. Appreciate it as always. Stay safe.
Thank you.
Thank you.
All right.
Take care.
Have a good day. That was Minister of Health, Honorable Nickolas Steele, and Grenada's COVID-19 Response Coordinator, Dr. George Mitchell, our guests this morning. We'd like to thank them both for sharing some information, and giving us a little bit of education this morning. That's the end of my time today, the end of the program. Thank you so much for tuning in. Those of you that participated, asked your questions. I'm still trying to answer some of the questions that I can on the WhatsApp. I will do so until Joseph barges it in the studio to start this morning's mid-morning buzz. Have yourselves an enjoyable, productive Wednesday. Stay safe. Those of you heading out, do what you need to stay healthy. Walk with your masks, hand sanitizer, gloves if you have them. If you do not need to be outside, stay home. If you do not need to get anything out there, stay home. Be safe, everybody. Have a good day.